then you need to start considering other things. For example, like I mentioned, it all depends on the choice of surgery. Just to quote a couple, which I already talked about, a lap band, something like a sleeve, in the initial few months after surgery, you may actually experience the increased incidence of acid reflux. And one of the presentations of acid reflux is, an atypical presentation is it actually goes down your respiratory tract and can actually cause damage to your vocal cords, can give you pneumonia, recurrent chronic cough that you're always coughing at night or waking up coughing. All those are fairly atypical but well-recognized presentations. We need to figure out if that's happening. A workup would be initiated to see if that is the case, and if so, what needs to be done about it. This may be completely unrelated to the bariatric surgery itself, something related to the thyroid, just like you mentioned. Enlarged thyroid gland can certainly cause pressure effects, and sometimes depending on what the nature of the enlargement is, it can even infiltrate the nerves that supply the vocal cord, leading to a change of the voice. So there are a lot of things to be considered, but it's definitely something that you should look at. You shouldn't just dismiss it offhand.
Is the thyroid testing, is that done in the blood work that I would be having?
So the blood work that we look at when you have your lab work done,
right,
that just tells us whether the thyroid is functionally where it needs to be. It does not give us any information about the pressure effects that may be related to the thyroid gland. To make that determination, additional testing, let's say in the form of a thyroid ultrasound or something like that, may definitely need to be done.
good. Thank you, Dr. Stalin.
Thank you. I have a question for Trevor. Trevor, what is the test you have to take for the study?
It's officially called the crazy test. Actually, we do a variety of different tests. We actually do something called the Milan Clinical Multi-Axial Inventory, MCMI. A lot of people have heard of the MMPI. I do that one because it works just as well, gives us the information we need, and is somewhere in the realm of 350, 400 questions less than some of you that have done the MMPI. And I see some head shaking. I think it took you like 17 days to fill it out, or true and false, and ask one question 17 times, So I think the MCMI is 175 items, if I believe. I also do a questionnaire called the Overeating Questionnaire, which kind of gets a look at where your eating comes from. The reason or what your eating habits are. And the reason I do that is kind of going back to what Nikki was talking about during her. Some people have, some of their weight issues are related to food addictions, and you need to have a good understanding of that going into this or post-op for maintenance. Whereas some people, there's other things going on that might be more dietary in nature. So we do that one, and then the screenings for depression and anxiety, because those play an important role. So since I'm up here, I want to make a comment on the support that you were talking about regarding myself. My profession is dealing with people. Support is the primary component to success with this surgery. Anybody who comes up here has had success. The vast majority of them have had excellent support systems, mostly through their own effort, okay? Because there's not a lot of people out there that are going to just come around you and circle around you and say, let's do this. And some of you have that, that's great. But if you listen to the commonalities of these stories, a lot of them have created it. If you come in to get into almost always I'm talking about support when you come to meet with me. Whether it's support through the groups, support through your family. I will recommend, because some people don't have many supports just in their closed system, sign up for a therapist, not because you may need it for depressive reasons, but sign up for a therapist to have an additional support just in your life, someone to come talk to. So my challenge is to everybody up here, because St. Mary's has their support group, first Tuesday. Okay? We have a support group over in the Thumb, that's the third Wednesday, right? And what I challenge you guys to do is start your own groups. Okay? Support does not need a professional. It does not need someone with a bunch of letters after their name. It needs people that care. Okay? And so we can only do so much because we do have other responsibilities and we want to help everybody and we will try. But if you want to succeed, if you want to get to where you want to be, find others that are like you and do it. Okay? Coffee shops. It doesn't really, second Sunday of the month. Okay, that's a good spot because it's the second, not first or third. But, so I kind of came in, I wanted to make that point, and it was a good segue that you brought up, but I want to say that because, we know my one time a month over in Huron and Tuscola County is not enough. One time over here is not enough. Some of you at certain points will know that you needed it weekly. You might have needed it twice a week. And online is good, but some of us are face-to-face people. So my challenge going forward is for some of you who have had successes and feel like you want to do something and give back, or for those of you going forward and you want to make sure you create a support system, find a way to get that going. Let us know, let Dr. Stalin, let Lisa, and we will advertise the heck out of it, okay, to the point where you got to rent out the Horizon Center or something like that. So anyway, that's all I have to say on that, but that was coming off of just a simple question on the test. But, it only takes, going back to the question, it only takes about 45 minutes to an hour to fill out the test that I have, so usually can plan for that and get that in and out in a day. So thank you.
My brother does that too. He talks forever when I ask him something. Just saying. You go ahead with your question.
I wonder what I can do through the course of the weight loss to maybe minimize the excess skin or the elasticity and encourage that.
I don't know, with Lance or Dr. Pittis or Stalin? I mean, who wants to stand up? Go ahead, Beth. Go ahead. Go ahead.
My skin loss from my surgery is very minimal. Now I know not everybody's the same, but when I was given the okay by Dr. Stalin to start working
In the
out.
mic, in the mic.
Oh, sorry. Can you hear me now? Okay. When I was given the okay by Dr. Stalin to start quote unquote working out, I had already been walking at least 1.5 to 2 miles a day. Because to get up and get moving helps with that, but just the working out, the strength training, and the cardiovascular together. So my skin loss, or my weight loss is significant, but my skin is very minimal.
Also remember, a lot of these bariatric surgical procedures have the propensity or the tendency to cause malnutrition if you're not careful about it. So, quite a few times I see patients come back for follow-up and it won't surprise me if they are deficient in one vitamin or the other or some micronutrient that's actually essential to their overall well-being and not just the skin elasticity part, but in general. And if that's the case, obviously, we need to work on correcting it. So follow-up visits and sticking to dietary supplements, your multivitamins, all that also becomes an integral important part of your post-op journey in making sure that your outcome is as ideal as possible.
And I'm going to segue that into having Megan stand up and really address how important your multivitamin is.
I was going to segue myself, so thanks, Lisa. Yeah, that multivitamin, all those supplements are super important. And I get a question a lot from people who say, hey, I went to Dr. Stalin's appointment and all my labs look great, so I stopped taking my multivitamin. And my head is just like, because a lot of times your labs are going to look great, but those nutrient deficiencies, they can rear their ugly head, and by the time those labs look bad, it's really bad. So you have a surgery that's been done that puts you at risk for malnutrition. You need to supplement. There's no way around it. You can't possibly eat enough. Lance and I were just talking to Nadia from Celebrate Vitamins, and we all take multivitamins. We're dietitians. I mean, if anybody knows the right things to eat to get all your nutrients, it's probably us, right? But we know there's going to be gaps in our diet. So very important that you keep taking those, even if your blood work looks great, keep taking them. I will say though, there are some people who are going to absorb some nutrients differently and maybe better than others, because everybody's different, right? We all have a different journey. So, if you get lab testing done and you find out you have very high iron content or something like that in your blood, you're not going to continue to take that multivitamin iron in it. We're going to work through it. So that's why it's really important to keep coming to see your dietitian. Just saying.
I think that was a plug for dietitians, I'm not sure. Doctor, let's see, is a history of previous heart disease a contraindication for surgery, and will the surgery help my heart?
No, it's not a contraindication as long as you had proper revascularization done if you had coronary artery disease, or and you have